speaking on the topic of fixing health information for ePatients and beyond. Please welcome to the stage Tal Givoly. Welcome, Tal.
Thank you. Thank you. Thank you. So I'm going to talk about an issue that we've all faced, and we heard this from all the ePatients that are here. And that's what happens when anybody falls ill, especially with a serious or chronic illness. And this happened to me as well. I spoke here 2 years ago, and I told the audience here about my daughter, Bar. She's now 17. And when we were told one day that she needed a new heart, like pronto, we were, of course, in shock. And I became what my subscribers are in MedAdvisor, is a chronic web researcher. But it turns out that there's research that actually shows that really health information is broken. And we were on a path to fix that. But let me tell you about the problem and how it looks. So when we turn to the internet for health information, we want to find answers. But what we find is really overwhelming, irrelevant, outdated, too difficult to understand, unsafe, really scary. By the way, if you add the word alternative or natural to any search term that you do, okay, the first page of Google results is deadly. Okay? Deadly. Okay? So try that as an experiment. Okay? Just add the word, because people are tending to do this. And it's a problem. Now, it's actually not just for the patients, but the patients are the one I'm going to talk about here today. So I met with Carmen Louisel at Doctors 2ONU in Paris. And she told me about a research that they conducted at McGill University. And they surveyed 1,300 cancer patients about their attitudes towards health information. And turns out that 60% are seeking more information, actively seeking more information. Of them, about 3.5% are what we call researchers. These are the chronic web researchers that don't stop until they find answers. But really, over 60% are actively seeking. There's a small group of 14% that are avoiders. And the research shows that these seekers, these researchers, are really not happy with the information that they're provided by their medical teams. They don't know their next steps in cancer care, despite the fact that they actually probably know more. And there's a large community of people that are unsatisfied, even though 1 in 20 searches online is of health. And we've all been there. And when we get to the situation, we kind of feel alone. But it turns out that actually many have been through these paths before us. We're not alone. And we could actually learn from the experience of others. So we were imagining what would be a solution to this problem. How would we redesign a solution? So first of all, it'll have to be personalized. Each of us is unique. I always ask, shouldn't our health information be? We're talking precision medicine. Even in advance of that, we could personalize the health information each of us gets. In order to do that, we need to provide something about ourselves, and in return, get the information that really matters to our situation. We need to be able to connect with each other. People are eager to help others through their experience. We need to keep it simple and light. It needs to be not complicated. It needs to be affordable. How about free? Why wouldn't we get this information? Of course, we need to maintain privacy, security, regulatory issues. We need to be concerned about that. We need to avoid the bias. My mother-in-law is telling us about my daughter's now problem with her thyroid, okay? And she's reading ads. She's seeing videos that are sponsored. Nonsense. And we need to explain to her that not only are these not relevant, these are just commercials. And not everybody understands all these things. It needs to avoid the complexity. So basically, what I wanted to share with you, there's actually, even though we all search for health information online, there's distinct patterns of how they do that. People that do that more intensely than others, and people that are casual about it. People that are very trusting and willing to accept advertising, natural remedies that are deadly for you, okay, in the short term, not only in the long term, certainly don't get you where you want. And we really need a different way of unbiased, trusted, personalized health information. Not only for the seekers and the 60% that actively pursue it, but for all of us. And I believe firmly that personalizing health information can come well before we actually get precision medicine for every one of us. So thank you very much.